Your body is trying to warn you. Right now, days before a heart attack happens, your body is sending signals, subtle signs that something is wrong. Most people ignore them, and that mistake can be fatal. I'm about to share information that could save your life or the life of someone you love. The warning signs that appear 48 hours before a heart attack. Signs that are easy to miss, easy to dismiss, but critically important to recognize. Welcome to the Milestone Mentor. If you or someone you care about is over 60, this might be the most important video you ever watch. Hit that subscribe button right now and turn on notifications, because the information we share on this channel could literally save your life. Don't skip this. Don't wait. Subscribe now. My father-in-law died of a heart attack at 67. For 3 days before it happened, he complained about feeling tired. He had indigestion. His wife told him to rest. He thought he was just overdoing it. Those were warning signs, and nobody recognized them. He died in his sleep, and we had no idea it was coming. Except we should have known. His body was screaming warnings, and we didn't speak the language. Today, you're going to learn that language. By the end of this video, you'll know exactly what to watch for, what to do, and how to potentially prevent a catastrophic event. Let's be clear about something from the start. I'm not a doctor. This information is educational, not medical advice. If you experience any of these symptoms, call 911 immediately. Here's what most people don't know. Heart attacks don't usually come out of nowhere. They're the culmination of a process that's been building, and your body tries to warn you. In the 48 hours before a major heart attack, your heart is struggling. Blood flow is restricted. Oxygen isn't reaching heart tissue adequately. Your cardiovascular system is under extreme stress, and your body responds with warning signals. A landmark study published in the Archives of Internal Medicine interviewed heart attack survivors about symptoms they experienced in the days and weeks before their cardiac event. A stunning 95% reported experiencing new or different symptoms in the month before their heart attack. Most noticed changes specifically in the week before, with the most pronounced symptoms in the final 48 hours. The problem is that these early warning signs are often vague and easily dismissed. They don't look like the dramatic chest-clutching moment we see in movies. They look like everyday complaints that you might brush off as stress, aging, or indigestion. This is especially dangerous for people over 60. You're more likely to experience atypical symptoms. You're more likely to dismiss symptoms as normal aging. And you're at higher risk for heart disease in the first place. This combination means you need to be extra vigilant about recognizing warning signs. Women experience different warning signs than men, and their symptoms are even more likely to be dismissed or misinterpreted. Studies show women are more likely to die from heart attacks, partly because they don't recognize their symptoms as cardiac-related, and neither do their doctors sometimes. Understanding the 48-hour window is critical, because this is when intervention can make the difference between life and death. If you recognize symptoms and seek help during this window, doctors can often prevent the full heart attack from occurring. They can open blocked arteries, restore blood flow, and save heart tissue before permanent damage occurs. The key is knowing what to look for. Let's go through the warning signs systematically, starting with the ones most people miss. This is the number one missed warning sign. We're not talking about normal tiredness. This is profound, overwhelming exhaustion that comes on suddenly and doesn't match your activity level. You feel exhausted after minimal exertion. Climbing stairs that never bothered you before suddenly leaves you depleted. Simple tasks feel monumental. You need to sit down frequently. You want to sleep more than usual. One survivor described it as feeling like someone unplugged me. Another said she felt like she was moving through water. This isn't the gradual fatigue of aging. It's sudden, intense, and disproportionate. Women especially experience this symptom. In studies, over 70% of women who had heart attacks reported unusual fatigue in the weeks before, with the fatigue intensifying dramatically in the final 48 hours. Shortness of breath. You're breathing harder than normal during routine activities. Walking to the mailbox winds you. Talking on the phone makes you feel out of breath. You can't complete sentences without pausing to breathe. This happens because your heart isn't pumping efficiently. so your body isn't getting enough oxygen. Your lungs try to compensate by working harder, leaving you breathless. This symptom often appears with activity initially, but as the 48-hour window closes, some people experience shortness of breath even at rest. You might wake up feeling like you can't catch your breath. Sleep disturbances. You can't get comfortable at night. You wake up frequently. You feel anxious or restless without knowing why. Some people develop sudden insomnia in the days before a heart attack. Others find they can only sleep propped up on pillows because lying flat makes breathing difficult. This happens when fluid backs up in your lungs due to poor heart function. Indigestion or nausea. This is a dangerous one because people almost always attribute it to something they ate. You feel nauseous, queasy, or have stomach discomfort. You might have heartburn or acid reflux that won't go away with antacids. You might feel full or bloated for no reason. Some people experience actual vomiting. The discomfort is often in the upper abdomen, which is why it mimics digestive issues. Here's the key distinction. If your indigestion is accompanied by any other symptoms on this list, especially sweating, fatigue, or shortness of breath, it's not indigestion. It's cardiac, jaw, neck, or back pain. Pain that has nothing to do with dental work or muscle strain. It might be a dull ache in your jaw, discomfort in your neck or throat, pain between your shoulder blades. This happens because of referred pain. Your heart shares nerve pathways with other parts of your body. So when your heart is in distress, your brain interprets the signals as coming from your jaw, neck, or back. One man described feeling like he had a stiff neck that wouldn't loosen up. 2 days later, he had a massive heart attack. The stiff neck was a warning his body was sending. Anxiety or sense of doom. This sounds dramatic, but it's remarkably common. Heart attack survivors frequently report feeling inexplicably anxious in the hours and days before their event. A sense that something is wrong, even when they can't identify what. Some describe it as a feeling of impending doom. Others just feel off or unlike themselves. This isn't psychological. It's your body's stress response to a cardiovascular system in crisis. Cold sweats. Breaking out in a cold, clammy sweat for no reason. You're not hot. You're not exercising. But suddenly, you're drenched in sweat, particularly on your forehead, palms, or chest. This is different from normal perspiration. It's cold, clammy, and often comes in waves. It might happen during rest or wake you up at night. Dizziness or lightheadedness. Feeling faint, dizzy, or like you might pass out. The room spins. You feel unstable on your feet. You need to sit down quickly or hold on to something. This happens when your heart isn't pumping enough blood to your brain. It's a sign that cardiac function is severely compromised. Arm or shoulder discomfort. Most people know about left arm pain with heart attacks, but it can affect either arm or both arms. The discomfort might be in your shoulder, upper arm, or even down to your hand. It might feel like aching, heaviness, tingling, or numbness. It might come and go. It might be constant, and critically, it has no obvious cause like injury or overuse. Irregular heartbeat. Your heart feels like it's racing, fluttering, or skipping beats. You might notice palpitations, where you're suddenly aware of your heartbeat in a way you normally aren't. This can indicate that your heart's electrical system is being affected by poor blood flow or damage to heart tissue. Now here's what's critical to understand. You might not have all these symptoms. You might have just one or two, and the symptoms might come and go, which makes people think they're not serious. Don't fall into that trap. If you experience any combination of these symptoms, especially if they're new or different from your normal, take them seriously. Call your doctor at minimum. If symptoms are severe or multiple, call 911. Now let's talk about what everyone thinks of when they imagine a heart attack: chest discomfort. But even here, the reality is different from what most people expect. Heart attack chest pain often doesn't feel like pain at all. Survivors describe it as pressure, squeezing, fullness, or tightness, like an elephant sitting on your chest, like a tight band around your rib cage, like someone is squeezing your heart with their fist. It might feel like severe indigestion that won't go away. It might be a burning sensation. Some people describe it as heaviness, or an uncomfortable awareness of their chest. The discomfort is typically in the center of the chest, but it can radiate. It might spread to your arms, back, neck, jaw, or stomach. It might come in waves, lasting a few minutes, then easing, then returning. Here's the dangerous part. Not everyone gets chest symptoms. About 1/3 of heart attack patients never experience chest discomfort at all. This is especially common in women, people with diabetes, and older adults. This means you cannot rely on chest pain as your indicator. If you have the other symptoms we discussed, even without chest discomfort, you could still be having a cardiac event. One more critical point. These symptoms might appear, then disappear completely, making you think everything is fine. This is called unstable angina, and it's a major red flag. Your heart is intermittently not getting enough blood, and it's warning you that a complete blockage is coming. If you experience cardiac symptoms that resolve on their own, you haven't dodged a bullet. You've been given a warning. Get evaluated immediately. Let's talk about action steps. What should you do if you recognize these warning signs in yourself or someone else? If you're experiencing symptoms, right now, call 911 immediately. Don't call your doctor's office. Don't drive yourself to the hospital. Don't wait to see if it gets better. Call 911. Emergency medical services can begin life-saving treatment on the way to the hospital. They can alert the hospital that a potential heart attack patient is coming, which means the cardiac team is ready when you arrive. And if your heart stops, they have equipment and training to restart it. While waiting for the ambulance, chew an aspirin, unless you're allergic. Chewing works faster than swallowing. Aspirin helps prevent blood clots from getting worse. Sit down and stay calm. Loosen any tight clothing. If you have nitroglycerin prescribed by your doctor, take it as directed. If you're with someone experiencing symptoms, stay with them. Keep them calm. Don't let them convince you they're fine and send you away. Heart attack patients often minimize their symptoms because they're scared or don't want to make a fuss. Insist on calling 911. Risk factors to know. You need to understand your personal risk level. The more risk factors you have, the more seriously you need to take any warning symptoms. Major risk factors include being over 60, family history of heart disease, high blood pressure, high cholesterol, diabetes, smoking or history of smoking, obesity, sedentary lifestyle, and chronic stress. If you have multiple risk factors and experience any of the warning signs we've discussed, you're on the side of caution. Get evaluated. Prevention. Starting today, the best way to handle a heart attack is to prevent it from happening. While we can't eliminate all risk, we can dramatically reduce it. Know your numbers. Get your blood pressure, cholesterol, and blood sugar checked regularly. If they're high, work with your doctor to control them. Take prescribed medications consistently. Blood pressure medications, cholesterol medications, diabetes medications. These aren't optional. They're life-saving. Move your body every day. Even a 30-minute walk significantly reduces heart attack risk. You don't need intense exercise. Regular moderate activity is incredibly protective. Eat more plants, fruits, vegetables, whole grains, beans, and nuts protect your heart. Reduce processed foods, red meat, and saturated fat. Manage stress. Chronic stress damages your cardiovascular system. Find stress reduction techniques that work for you, whether that's meditation, time in nature, connection with loved ones, or therapy. Don't smoke. If you smoke, quit. It's never too late. Your heart attack risk starts dropping within hours of your last cigarette. Create an emergency plan. Right now, while you're healthy, create a plan. Keep a list of your medications, allergies, and medical conditions in your wallet and on your phone. Tell family members where this information is. Program 911 into your speed dial. Keep Aspirin accessible. Make sure someone knows your doctor's name and phone number. If you live alone, consider a medical alert system. These devices can summon help even if you can't reach a phone. Talk to your family about warning signs. Make sure they know what to watch for and will call 911 if you exhibit symptoms, even if you resist. Studies show that the average person waits over 4 hours after heart attack symptoms begin before seeking help. 4 hours. In that time, heart muscle is dying. Why do people wait? Let me tell you the dangerous thoughts that delay treatment. I don't want to bother anyone. Your life is worth bothering people for. A false alarm is infinitely better than dying because you didn't want to make a fuss. It's probably nothing. Maybe it is nothing. But maybe it's a heart attack. Are you really willing to bet your life on probably? I'll wait and see if it gets better. By the time it gets worse, you might not be able to call for help. Early treatment saves lives and prevents disability. I'm too young to have a heart attack. Heart attacks happen to people in their 40s, 50s, and 60s all the time. Age doesn't make you immune. It's just stress. Stress can cause symptoms, but so can heart attacks. Get checked out and let professionals determine the cause. I'm embarrassed if it's a false alarm. Emergency responders would rather evaluate 10 false alarms than arrive too late for one real emergency. They will not judge you. They want you to call when you're concerned. Here's the brutal truth. People die at home because they were too embarrassed, too stubborn, or too scared to call for help. Don't be one of them. Time is heart muscle. Every minute that your heart isn't getting blood, tissue is dying. The longer you wait, the more damage occurs, and the worse your outcome will be, even if you survive. Early treatment is everything. If you get to a hospital quickly, doctors can open blocked arteries with medications or procedures. They can prevent permanent damage. They can save your life and preserve your quality of life. But they can only do that if you give them the chance. They can't help you if you're at home telling yourself it's probably nothing. I need you to do something for me, right now. Look at the person you love most in the world. Picture them. Now imagine explaining to them why you didn't call 911 when you experienced heart attack symptoms. Imagine telling them you thought it was nothing. You can't. Because if it was a heart attack and you waited, you might not be around to have that conversation. Your life matters. The people who love you need you. And recognizing warning signs can be the difference between life and death. Subscribe to the Milestone Mentor right now. Hit that subscribe button and turn on notifications. We're dedicated to giving you information that protects your health and extends your life. This channel could save your life or the life of someone you love. Share this video. Send it to your parents, your spouse, your siblings, your friends. Everyone over 60 needs to know this information. You could save a life just by hitting the share button. Leave a comment and tell me, did you know these warning signs? Have you or someone you know experienced these symptoms? Let's learn from each other's experiences. And here's my final ask. Print out the warning signs. Put them on your refrigerator. Keep them in your wallet. Make sure you and your loved ones can recognize them quickly. Remember, unusual fatigue, shortness of breath, indigestion that won't quit, jaw or back pain, cold sweats, dizziness, arm discomfort, anxiety, and irregular heartbeat. Any of these, especially in combination, especially if they're new, deserve immediate attention. Your body talks to you. It sends warnings. Don't ignore the message. Call 911 at the first sign of cardiac symptoms. Don't wait. Don't guess. Don't hope it passes. Call for help. Thank you for watching the Milestone Mentor. Thank you for taking your health seriously. Thank you for being here. Now go share this information. You might just save a life today. Subscribe, stay informed, and stay alive. I'll see you in the next video.